Hello, I am Dr. Charlene, and I wanted to talk about cholesterol. This is a topic that comes up in my clinic often, and it's actually a misconceived idea of what's going on in the body. And there's a lot of misnomers around cholesterol. So I want to dispel those myths right here, right now. Many of my patients come in and say, "Oh my gosh, Dr. Charlene, my doctor did my blood work and my cholesterol is off the charts and they're telling me to take all this medication and I don't know what to do." So when this happens, I like to educate my patients on what is actually going on in the body when cholesterol gets high and what we can do about it to resolve any issues without medications. And there's a place for medications. Sometimes it is necessary to have a little bit of medication here and there. However, statin medications, the ones that they use to reduce cholesterol in the body, are the worst class of drug, in my opinion. It actually starves the brain of cholesterol, which is its secondary food source. And after long-term use on statin medications, it typically leads to things like Alzheimer's and other types of dementia. So I recommend you avoid it as best you can. Now, the normal ranges for cholesterol, for total cholesterol, is less than 200, so 199 or lower. And then the normal for LDL is less than 100. And LDL has been called the bad cholesterol. And this is one of those misnomers. There's not good or bad cholesterol. They refer to the HDL as good cholesterol. Neither of them are good or bad. Our body makes cholesterol naturally. We actually make it in the liver for the purposes of reducing inflammation. I like to think of the cholesterol in our body as tiny little firefighters that are going out to put out the flames that happen with inflammation. And so our HDL, what they call good cholesterol, is really kind of like the firefighters that get that alarm bell and they hop in the truck right away and they immediately drive to your house to put the fire out. So they're the ones arriving quick on the scene and they're using the big hoses to put out the fire and just get it under control. And then that cholesterol will return quickly back to the fire station, also known as your liver. And then what happens is the LDL cholesterol, what they call the bad cholesterol, that's like the fire cleanup crew. So these are the guys that go out and make sure that there's no smoldering little fires that are going to set off a bigger fire. And then they do all the cleanup. If you know anything about the fire service, then you know that the firefighters aren't just there soaking the fire with all the water. They usually stay behind or send out another crew to go knock down beams and kind of demolish anything that could be potentially hazardous. Like the house could cave in from the structural integrity being weakened. And so that's the LDL cholesterol. These guys are going out, they're doing that later term cleanup. And so it's slower to return back to the fire station, to the liver. And so if somebody has high LDL cholesterol, which is typically what they're looking at when they want to give you a statin medication, if that LDL cholesterol is high, then that just means you have a lot of low-grade inflammation out in the body. And simple things like proper diet, proper exercise, and stress reduction can actually help reduce that high LDL cholesterol. And then we want our HDL cholesterol to be higher. Those rapid response firefighters, we want a lot of those, right? If your house catches on fire, you want somebody right next door that knows how to come and put it out. And so we want plenty of those HDL guys out there. And we need a good balance. And the last thing I want to leave you with is a marker that sometimes the lab will provide for you. And if not, it's a very simple calculation. All it is total cholesterol divided by HDL cholesterol. And this is going to give you a ratio. And this ratio is actually the most indicative of whether or not you have a high risk for heart disease. And this is something you can simply see on a basic blood panel. There are other great ways and blood tests to look into whether or not you might be at risk for heart disease, but they're not often run by regular MDs. So this one simple marker, total cholesterol divided by HDL, is a really simple way to determine if you're at high risk for heart disease. And so when you take that number, total cholesterol divided by HDL, you want that ratio in the good range to be 3.5 or less. And then in the great range would be 3.1 or less. So if your numbers are coming in that ratio less than 3.5, that's a really good indicator that you have a low risk for heart disease. And simple management of your diet, exercise, and stress response will be able to manage and reduce your cholesterol that way. Now, if it's higher than the 3.5, then reach out to a functional medicine doctor, somebody like myself, who can then help guide you on what to do, maybe what supplements are going to benefit. There are great non-pharmaceutical supplements that will still help reduce your cholesterol. It'll save your brain from that issue with Alzheimer's or dementia, and it won't cause joint pain and stiffness like the statin medications do. I hope this was beneficial for you. Thank you so much for listening. As always, be well.